ultimate men's movement with our host, Dr. Jack Rocco. Dr. Jack, how are you? And now we're ready to just dive deep. Part one was what is low T? Why is it happening? Now the treatment. And the treatment is it going to be at the Ultimate Men's Clinic? And what's the next step for people that know they have low T?
Yeah, I think the treatment of low testosterone, like I said, I think everyone can agree that men's testosterone level is low. We've addressed that in our last episode. But I think there are some concerns with treatment. Guys have a lot of concerns, and we talked about before that the effects of it, the side effects, and the stigma of it is often misinterpreted. Traditionally, in the last several decades, testosterone is something you hear about that's occurring in the gym. I had a friend not long ago who was on testosterone, and like, where do you get it? I get it from my buddy at the gym. I'm like, dude, that's not safe. I can't condone that. That's not something I would recommend. I said, yeah. So I think it's something that is nuanced enough, and guys are doing it. Guys are getting steroids, getting full on anabolic steroids. It's something that's fully rampant in our culture. But I think it's something that needs to be carefully monitored and carefully treated. I think the part of my purpose in starting the clinic is that so the guys don't have to go to the gym. You can get proper treatment that's properly monitored. You're getting quality medication that's dispensed in a responsible manner. I just think there's fewer. If you're gonna do it, I think it should be done properly. And I think physician guidance is clearly preferred. Like I said, but a lot of guys still have the stigma of, I'm not a gym rat. I'm not the guy who's going, looking to get big biceps, looking to bodybuild. But those guys' levels are exceedingly high. The levels that they shoot for are, I think, dangerously high at times. Or they just keep taking it. They don't even monitor. They're not getting blood work. There's a lot of potential complications from it. And even in the 80s, a lot of the Bobby Bonds and the McGuire, all those guys who were taking steroids and tests and all that stuff in the back, they were also taking multiple other combinations of medications, including illicit drugs. Let's face it, there was a lot of illicit drugs and improper use of steroids back in the day. And I think we're still suffering from a lot of that stigma of that. So current day, the way I see the responsible use of testosterone currently is for that average 40 to 60-year-old male, 40 to 70-year-old male. And it treats a lot of those symptoms that men struggle with every day. Crankiness, mood. The benefits of it are significant. So the first thing I think is identifying the problem. So if you have the symptoms, a blood test is easy to get. And typically when we get a testosterone blood test, we're also getting a PSA level just to make sure there's no risk of prostate cancer or other issues. So it's a good screening test. And once someone's been defined as having low T, or hypogonadism is another word for it, that the first step would be to consider optimization of your level. Some people talk about testosterone replacement therapy. It's not technically replacement. It's more optimization. And the idea is to get it into a functional level. Because testosterone, like many other hormones, it's level dependent. So if your level is too low, it's not that you don't have it, you just need more. Your testicles aren't able to keep up with it. The range that I typically shoot for, like I said, is between 500 and 800. You start getting up close to 1,000, that makes me a little nervous. Below 500 really isn't doing as much for you, especially if you're having symptoms. Someone comes back and they're defined as having low testosterone. They've got a level of 300-400. Typically, we've been using a cream, and there's different modes of replacement. A lot of guys are doing needles. There's a couple different types of testosterone that is injectable. The injections scare off a lot of people. I don't want to give myself shots. I'm afraid of needles, and there's no way in heck I'm going to shoot myself. I can agree with that. I can agree with that fear. Most guys are not excited about breaking out a needle. And then where do you put the needles? How do you store the needles? You got to buy the needles. I think it's an effective way to do it. It's just inconvenient and a lot of phobias that come along with it. There's other forms of it that we lean towards. We use a compounding pharmacy that makes a cream, and the cream is easily it penetrates the skin easily. We recommend that you take 1 or 2 pumps. It comes in a dispenser that, like a shave can or shave cream or any kind of lotion. You take out a couple pumps, couple squirts, which gives you about not even a dime size, small size of cream. We recommend rubbing it to the skin along the scrotum. And what that does is it mimics your body's own, that's the area where it's produced. So that cream will penetrate through the skin, penetrate through the blood vessels, and be absorbed into the system, very similar to how it's absorbed naturally, how it's created naturally. And it's a cream that's applied on a every night basis. So before you go to bed, preferably if sexual activity is involved, usually recommend doing that afterwards. And if you forget at night, you can do it in the morning, but we usually recommend at night. Applying it at night gives you more of that physiologic level. And we've talked about this before, that men are creatures of the sun. So that normally you go to sleep, your testosterone levels rise, your testicles produce it, you wake with that familiar morning wood. And that's one thing that is also another sign of either vascular issues or testosterone issues. If you're not awakening with an erection, that's potentially a sign that your testosterone level is low. So one of the first things that guys will experience is, Doc, I woke up with that old friend. The old morning wood was there in the morning again once people start doing it. So that's a good sign. And then, like I said, if it's more of a physiologic dosing. If you're doing injections can be once or twice a week. You can do every other day. There's different protocols you can use. But in general, like the most commonly used is probably once or twice a week injections. But that'll give you a nice spike in your testosterone, and you may notice that more. But it's almost a mania. And then over the next several days, 3-4 days, it's going to go down, and then you're almost a low. Whereas and then you go back up. So the highs and the lows with injections seem to be much more exaggerated. As opposed to the cream, the idea of the cream, it's giving you a daily fluctuation that keeps your level somewhat more physiologic. So that's typically what I recommend. And I think the cream is just easy for guys. They're like, I just rub it on my nutsack. And you're like, yeah. You just, before you go to bed, just take a little dollop, rub it in, make sure that it's thoroughly absorbed, and that'll do it. And once we start the therapy, guys will call back, or I'll contact them after a month or so, but guys are like, oh, I noticed immediately. My mental acuity is sharper. And there's studies that show even like your ability to think in 3D and spatial recognition, your reaction skills are higher. It brings back that mojo, that male mojo, head on a swivel, athletic competition. Another interesting fun fact I learned about testosterone is that the thrill of victory. Remember the old thrill of victory and the agony of defeat? The thrill of victory actually stimulates your body's own production of testosterone. Whether that be you were in a competition and your team won the championship and you're all fired up. Your testosterone level will increase exponentially for the next several days. And even if the Steelers win, if you got the Steelers win the Super Bowl, Steeler fans are going to have a higher testosterone level for a few days after. So it's something that your body incorporates into, like I said, a lot of the things that you are able to relate to as a male characteristic. That, oh, he's all fired up, his team won this week. There's some effect from testosterone of that. I'm saying like the guys will start to feel that spark, that excitement, that the joy of living, that, hey, I had a great day yesterday. I closed a deal. I've been working with this business and I had a nice sale. That thrill of being a man, that thrill of victory is enhanced on testosterone. Okay. And guys will notice that right away. Guys will notice it's not typically something that you associate with size, right? But there is a little bit more circulation, whatever it is. There's a little more girth. There's a little more structure there. And some guys will also complain without testosterone, with someone with low T, they're like, I don't have feeling down in my penis. I don't have a sensation down there. It's numb. It just feels numb. It's not technically numb. If you hit it with a needle or pinch it, they will respond. So the sensation is normal. But there's some special sense of vitality, of interest, that testosterone will bring back that sense of, yeah, I feel that it's there. It's not dead. I'm not losing it. So that's something that the guys will complain, or guys will report as being improvements. And then muscle mass and visceral fat. People will start to see their fat, because that male belly, that's a result of low T, especially the visceral fat. And that's dangerous. And cardiac fat. You get fat around your cardiac. These are dangerous things. The visceral fat, testosterone reduces that. And guys will start to notice. I've personally been on it, and I have less of a gut now than I did 10 years ago. But also muscle mass. And if you work out, which I would recommend, this doesn't replace all the healthy things that you should be doing. It's not designed to help.
It's another tool.
You know what I mean?
And that's it. So how do we find out?
Yeah, that's what I love about incorporating all these issues. We're going to give you advice on your diet. We're going to give you advice on exercise. Give you advice on testosterone. We're going to talk about your mental health. All these issues, it comes together. That's the holistic approach to it. And we're seeing great results. And guys are saying, yeah, it's better in the bedroom. It's better in the gym. It's better in the sales room, in the boardroom. And it's one of those things that you're not going to know until you try. Exactly. You know, what's that? Why? Yeah.
So best place people can go is theultimatemensclinic.com. You're in New Bedford, Massachusetts, but ultimately people can travel anywhere to go come see you.
Yeah. And I've got multiple licenses. It can be shipped from the pharmacy. That's a lot of these companies. So their telephonic visits are certainly something we can do as well. And I see no reason not to give it a try. Anyone who's feeling that the doldrums of middle age and life and whatnot, it's worth a try. It beats antidepressants, I'll tell you that. At least it's a reasonable place to start.
All right. Appreciate it, Dr. Jack.
Thank you, Neil. Always a privilege.
All right. That is a special simulcast of the Neil Haley Show on the Ultimate Men's Clinic, guys. Movement. I always want to say clinic. Movement.
It's both.
All right. Take care. Bye.